Hello and good morning to everyone. Thank you so much for joining our webinar today. I see a few people joined in quite early, so thank you for that. And we look forward to having a wonderful session this morning. We'll be talking on the topic of personalities. What are personalities? What are personality disorders? How they affect us at work, and how we can improve on that. So, joining us this morning is Mary Wanyama. She is an expert in this field. She's also one of our trainers here at ACCUREX, and I'm excited just to see, and we encourage her as she starts on this wonderful topic. The structure of the webinar is 45 minutes. We'll do a presentation for 45 minutes, and then we'll have a Q&A at the very tail end of the webinar session. We welcome any comments, conversations. So if you need to talk or to contribute, depending on where the session is, feel free to raise your hand. We'll give you a chance to talk. And if you have questions or any other engagements, let's do them on the chat box. This is it. Mary, this is your turn. Over to you and have a wonderful session ahead. Thank you.
Thank you so much, Purity, and good morning, the rest of the team.
Good morning to you, Mary.
I hope you're all well and ready.
Good
Uh,
morning.
uh, I believe we are all ready to take in this knowledge that I'm going to share with you. We're going to look at understanding personalities and personality disorders in workplaces. And I'll just pose to you a question before we kick start it in 1 minute. You can put in the chat box. If you are to be an animal, what kind of animal will you be and why? If you are to be an animal, what animal would you be and why? Just put that in the chat box because, of course, we are looking at personalities and personality disorders. Okay, just scribble down in the chat box for us to see. If you are to be an animal, what animal will you be and why?
Mary, we have some comments. Stephen is saying he will be an ant, most organized.
Eh, okay, then
Jason is saying lion, strong, targeted, focused, and many competitors. We also have Simon saying ego, very focused. So they're giving you the animal and why they're choosing why that animal.
yes, yes,
Jennifer is
yes.
saying lioness, protecting her boundaries. Kacheso is saying a chameleon dies for its siblings. We also have fish swimming through issues. Lion, I will have freedom. So quite interesting inputs there.
Okay, thank you, Tim, for those who have contributed. I'm excited, at least from your point of view or where you are seated, where you are standing, you get to understand if you are to look at yourself in a different angle and you are able to define who you are. And that now brings us to this, topic of understanding our personalities and personality disorders at workplace. Why this is necessary for all of us? Of course, we will be able even to tailor our tasks based on the personalities that we possess. Either it's a normal personality or it has some sort of and improve on our areas of weaknesses. So, first of all, I would like us get to know what is a personality, because when you're talking about personalities and personality disorders, we basically need to start from scratch, whereby you get to understand what is a personality. And when we talk about personality, we are basically looking at those characteristics that are portrayed by an individual based on, perceiving things or perception, how you view things, the way you feel, the way you react to situations, the way you cope, and the way you are also reasoning out. So it will bring out that pattern. It is an organized way, the way you react to circumstances, and now brings out this kind of personality, and not just on a one-off time or a single period of time, but it is a kind of a lifelong kind of pattern that will portray these characteristics that you're talking about, and now it builds you, and it is ingrained in you and brings out what we call the personality. So personality will emerge from several angles, from all biological dispositions. You look at, the genes. You can, adopt your personality based on biological dispositions. Then psychological experience, what you have gone through, and psychologically you develop a certain mechanism and a pattern of how you are reacting, how you are, thinking, how you are reasoning, how you are, responding to things like, stress, anger, and so on. So you realize that even environmental situation can enable you to develop a certain kind of personality as an individual. Why is this so important to us to get to know our personality? Why is it so important for us to know our personality? Perhaps someone can just put it in the chat box as we continue. Why is it necessary for us, team, to get to know our personalities? Yeah, anybody with a contribution? Because you realize that it is a lifelong kind of pattern that has been portrayed in you. It is not just a one-off kind of action. You can be, a gentleman, but it can be a one-off kind of aspect whereby you decided, no, today I just want to be a gentleman and act like a gentleman, or I just want to be, this kind of person. But when it is repeated, it is a kind of a situation where you are, repeating these events, then it becomes part of you. And when one wants to define who is who is Purity, or who is Mary, they are able to define you based on what characteristics, what traits have you portrayed as an individual. Now we'll go ahead and okay, there's somebody who has given us a contribution.
Yes. Do I
Yeah,
put it out for you, Mary?
sure, go ahead, Purity.
Okay. You asked why it's important to show these characteristics. So I'll just read a few
Yes,
comments, but also you can read
sure.
on your part and tell me which ones you want to focus on. So one is to
Okay.
avoid misunderstandings. That was from Catherine. Miss Sandy,
Perfect.
to help us identify our strengths and weaknesses. Faith says
Exactly.
it explains how you show up and how people experience you based on their personality. CHRP
Mm-hmm.
Rebecca, to be able to identify who you are. Barbara is telling us, you know how you react to life situations so that you can plan accordingly. And Stephen,
Mm-hmm.
know your personality traits helps us gain a deep understanding of ourselves. It's
Okay,
self
thank you.
awareness.
Thank you so much, Purity, and the rest who have contributed. That is awesome from you people. You're a great team. Now, all the comments that you have given and contribution regarding understanding of our personality is actually right, because we are able to know how, who is Mary and who is Zipporah and who is Jacqueline. So we are going to break down these personalities in, four parts, and we are going to look at it in this model. We are going to use this model that we call disc model, for us to understand our personalities. Now we may have individuals with the personality of dominance, and at workplace you realize that these individuals, they're the drivers, and they're result oriented, they're direct. In when it comes to, performance, they're very competitive and decisive. And these individuals with these personality disorders at workplace or in our social gathering or interactions, you realize that the key traits of these individuals are very bold. So you look at yourself and you can yourself as somebody who is bold. you are a dominance. Your strength lies in the confidence that you possess as an individual, and you are always a goal oriented. Now, the bigger challenge with this kind of personality is that at times they tend to be very impatient. Why the impatient part of it? You realize that if you are a goal oriented, if you are a result oriented, the eye is always on the ball, the goal that you are going to achieve. And remember, in line of our duties, we always have the disruptors. We always have distractions. So at the end of it, you realize that you will get impatient. And you are focused on relationship, and therefore you'll want to make sure that you are using that time. So the key challenge with these individuals, at some point you tend to be disorganized because your attention is diverted to making relationship at workplace, and you realize that these people, they will go along with others, but when it comes to productivity, at some point there's some sort of lagging. Okay, so you realize that these individuals have a challenge of being disorganized sometimes, but they work very well. The best environment that they can perform their duties in is a social environment and a dynamic environment. Any changes in the work environment, for them, they will take it positively. They are not rigid to it. So you realize that they work very well in such kind of environment. But when it comes to motivation, you realize that these people are motivated by recognition. If you are social and vibrant in workplace, in social gathering, or whichever place you are, of course, you stand out. The recognition aspect comes out, and people will always know, yeah, so and so. And with these people, we have them in the organization. And if you want any help, you'll be directed that go to Grace. Grace is the best person to support you on this activity that you want to be supported, or to get the explanation from Grace. Then this individual, we have another category of personality where we are looking at the supporters. And these individuals, they are very patient and cooperative. And I don't know, it's only me who has ever worked with the IT support team. This individual, you can ask them today a question. Maybe it's just a technical or a simple issue concerning your laptop or your machine at workplace or the server. They will help you today. And then tomorrow you have forgotten and you still go back to them. I don't know if I'm the only one who has ever worked with such kind of people, and especially in productivity, at some point, there's nagging. Okay, so you realize that these individuals have a challenge of being disorganized sometimes, but they work very well. The best environment that they can perform their duties in is the social environment and the dynamic environment. Any changes in the work environment, for them, they will take it positively. They are not rigid to it. So you realize that they work very well in such kind of environment. But when it comes to motivation, you realize that these people are motivated by recognition. If you are social and vibrant in workplace, in social gathering, or whichever place you are, of course, you stand out. The recognition aspect comes out, and people will always know, yeah, so and so. And with these people, we have them in the organization. And if you want any help, you'll be directed that go to Grace. Grace is the best person to support you on this activity that you want to be supported, or to get the explanation from Grace. Then this individual, we have another category of personality where we are looking at the supporters. And these individuals, they are very patient and cooperative. And I don't know, it's only me who has ever worked with the IT support team, this individual, you can ask them today a question. Maybe it's just a technical or a simple issue concerning your laptop or your machine at workplace or the server. They will help you today. And then tomorrow you have forgotten and you still go back to them. I don't know if I'm the only one who has ever worked with such kind of people, and especially in the IT. I'm not saying that the state or the supporters lie in the IT department, but according to my experience, I've had a chance to, encounter anyone who has ever encountered that, especially the IT people. You ask them a weird question and a simple question, and they will still repeat the following. I don't know if there's anyone who has ever worked with them. Yes, Grace says she has worked with them, and you realize that they're very patient. So individuals, their key trait is that they're very patient and very loyal. Even Washington said so. Yeah, they are very so you realize that these are individuals, and that is their personality. They are very steady, and their key trait is their loyalty. They are very patient. The strength lies in their in reliability. You realize that they are very empathetic people, because if you are very patient, also you will carry that aspect of empathy. Then the challenge is, at some point, they can be resistant to change. They can resist change because of what? They have used to a certain way of doing things, and their patience lies within that angle of performing the duty. So you realize that when something else comes up, you realize that it becomes now a challenge. But they work very well. The best environment that these individuals will perform in, you realize that it's a stable and a predictable environment. Their motivation is harmony and relationship. Of course, the communication style is very warm and calm individual. So you realize that if you try to relate to what happens in your organization with this kind of personality, or individuals who possess this personality, you can single out those pointers. Then we have another category of individuals who are conscientious, the thinker. These are people who are also detail oriented and are so analytical. And this now lies to the category of people who are in the finance. I'm not, being personal when it comes to this finance, the finance team, but you realize that they are always detail oriented. If you are dealing with the matters related with the finances, you have to bring in a receipt. They will look at it in a detailed way, isn't it? I hope you've encountered this. Yeah, the professionals who want logic. They don't want, like, stories like, I left town, I went to Mombasa Road, and they want, if it's a matter related to finances, they just go straight to the point. I hope you have gotten something on that. Then now, this takes us to the point where now we want to look at now these other personality disorders. Yeah, we said a personality, it is that pattern of your characters that are portrayed when you are perceiving things, when you are reacting to situations, when you are trying to think about something, or how you behave, and it turns out to be a lifelong kind of pattern. But now when we bring in the aspect of personality disorders, you realize that this is a mental health condition where people have lifelong pattern of seeing themselves and reacting to others in a way that it is also demeaning to others, and they find it difficult to control their emotions, their anger, their frustration. And if you are unable to control your anger, if you are unable to control even your emotions, if you are happy, you don't care who is surrounding you, you just take your position and react, or you have that outburst in terms of anger you are not able to control, then it turns out to be a personality disorder. And remember, team, not a one-off kind of aspect. It is a continuous, it's a continuous kind of pattern. It is a lifelong pattern. Of course, in one of time, you'll find yourself reacting, having an anger outburst, but that does not mean that you may possess these disorders. It is just a kind of duration, or this specific time that you've gotten yourself into this situation and you have reacted. But the next time you won't be so impulsive. when you are handling or you're reacting to situations or behaving. So when we talk about disorders now, it gets to a point where you are reacting in in a manner that for you, at times you may feel that it is normal. And by the way, we have individuals who have personality disorders and they don't know that they have these personality disorders. It is very possible because sometimes for you, you may think that that is how life is. Reacting, that is how you are supposed to react when you are angry. When you are happy, that is how you are supposed to react. And you don't know that you are even causing problems to your family, you are causing problems to people who surround you, workplace, school performance, and so on. Now we are going to look at each and every type of personality disorders. Personality disorders are classified uh, into three categories. And this classification, sorry for that. Okay, so we are going to look at the classification of these personality disorders that we may possess. And remember, even at workplace, if you're possessing some of these personality disorders, that doesn't mean that you're not qualified for that job. In fact, if people who possess these personality disorders, they are very qualified, have very good experience, but you realize that there's a certain weakness that we have even themed this individual that this so and so is always like that, doesn't like socializing. So this classification of personality, they classify them based on the behavior and the way you think and the you possess as an individual. Okay, you carry eccentric kind of behavior. Then the cluster B, you realize that they are classified based on the dramatic, or they are overly emotional. They carry erratic kind of behavior, the mood swings and so on. Then cluster C individuals, you realize that they are classified based on the fear. Now, under cluster A, we realize that we have individuals with paranoid personality disorder. This is an individual who lacks trust in others, and they're always suspicious. However much you try to get closer to these people, they will shift. They will not want to hold on that. They will always want to keep to themselves. They don't confide in any others. We know that we are human beings and we were created in a way that socializing is always there. We are social animals. And people who are closer to us, when it comes to situations where we need to speak out and talk to people, we will always confide in people who, are closer to us. I was listening to a certain clip where a gentleman was saying he's hating on a particular, manager whom he has never met because the wife keeps on explaining to him that so and so is doing this to me. So you find that you are hating on somebody whom you have never met, because we are social human beings and we are prone to share information, especially to those people who are close to us. But these paranoid individuals, they will not confide in anybody. Even those who are closer to them, they will always shift. Yeah. And they will slide even comments for insult. And this is where even you see people commenting on social media that, kwani haujui jokes. So you realize that it is kind of, a consistent kind of pattern that has made this person to carry what we are calling this personality disorder. And then under this cluster A, also classified based on their behavior or how the suspicion that they carry around, we have schizoid personality disorders. So they appear not to be interested in others. You realize that now for them, they want to isolate. They enjoy the solitude. They just want to be on their own. And they cannot pick a typical social cues. In fact, even maintaining intimate kind of relationship, for them, they will not have. You realize that this person chooses to be single and to be alone and keep to themselves. And someone will ask me, what is the difference between an introverted person and a person with schizoid personality disorder? Anyone who can try on that before I explain? What are some of these differences that we can single out? You can say, of course, introverted individuals, they like, can we classify them that, individual who possesses personality disorders? No. So what are some of, what is this difference that we can single out between an introverted person and a schizoid personality disorder? Team, anyone who can try before I explain to you? Okay, so I'll go ahead. And if you have a point, you can just write in the chat box. I'll go ahead and give you the difference between schizoid personality disorder and an introverted. You see, an introverted person will enjoy solitude. But when it comes to social interactions, they will be there. These are individuals. They will have spouses. They will get married. They will interact with the people, but on minimal grounds. But you realize that these people with schizoid personality disorders, they have what we call social detachment. They just don't want, and it's a lifelong kind of pattern that has been happening with these individuals. So they're in the office and they want to keep on themselves. They want to sit in a particular corner and nobody should come closer to them. Then now we have under still cluster A, we have schizotypal. Now these people, they have what we call magical thinking. Individuals to start hearing whispers or voices even calling out their names. And now that one triggers what we call social anxiety. Because imagine in a situation where you are in a crowd or in social gathering or at workplace and you're hearing someone calling out your name, Grace, 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 Grace. So you realize that it's going to trigger social anxiety to the extent that you feel like at some point you may feel like you want to respond to that whispers. And it's a continuous kind of pattern. And at times they will look at information in a different angle. That's why I say they are like, they have what you call magical. For anything to happen, they're kind of superstitious. They relate it to this. The cat crossed my road. The black cat crossed my way when I was going to work. So that is a concern. And it sticks in their mind forever and forever. And now it turns out to be a disorder of this particular individual. Are we together, guys? Can you please just write down if we are together? If you're getting something, perfect, perfect. Thanks for those who responded to that. Thank you so much if you are learning something. Then now we go to cluster B, which we said that these individuals are classified based on they are overly emotional, overly emotional. You realize that these individuals with this kind of personality disorder, they have erratic behavior. When you talk about erratic behavior, it's just like the changes of mood swing. Today you're okay, you're good, you're happy. Tomorrow you are down, and it's a lifelong pattern. It is not a one-off thing, and you're just struggling with mood swings. So we have borderline personality disorders under this category of cluster B, whereby they have strong fear for being alone, abandoned. And therefore, these people, they feel empty. When they are alone, there's that aspect of emptiness and they see themselves as unstable and weak. Now they will seek for deep relationships that are not even stable. Remember, if you have a gap of feeling empty and now you want to, belong to maybe a particular relation just to satisfy that thirst that you're having, you realize that you may have an unstable relationship. Why? You're going to learn on wrong people. You'll not even learn, analyze this particular person that you're falling into in this particular relationship because you fear being alone. And you may have ups and down moods. The mood swing is associated and, underlined with this particular individual with these personality disorders. Then we have histrionic personality disorders. These are the one we call that we are calling attention seekers. These individuals, they will do anything, and even when it comes to even getting into relationship, I'd rather get a celebrity so that people get to recognize me. Not that you love that celebrity, that is because in your mind you have this disorder and you can do anything. And at times, even at workplace, we are having board meetings, departmental meetings. These people consistently will be bringing out topics that are relevant to create humor for the attention to be aroused from this particular audience that are in. So these things that a relationship with others are closer than. They feel like when they are closer to others, they feel that they're impressing others. And to some extent, you realize that even they are not humorous to those people who are closer to them because it is a consistent and a continuous pattern that has taken a longer period of time and it has ingrained in their behavior, and now it has turned to be a personality disorder. Now we get to this narcissistic personality. I know this one, most of you know it. Because I've had sessions where people are discussing about this narcissistic personality disorder, and you realize that these individuals who are mean, and they believe that they are very important more than others, and they want, to be admired. And this is an individual who will do anything to be admired. They feel so superior, and often they admire. Okay. Mhm. Are we together, team?
Yeah, Mary, we are, but we had lost you for a couple of seconds.
Oh, sorry for that. Okay.
Please repeat from the narcissistic disorder. We lost you.
Okay. Okay. Thank you so much. Thank you so much for raising that. Okay. So we are talking of narcissistic personality disorders. You realize that these people who take advantage of others and are very jealous. You realize that in a team, when you are working in a team, we always clap for those who are winning, and we will always celebrate their whatever they are win. But you realize that this individual with these personality disorders, they will not take it as an achievement for the whole team, and they will do anything they don't care about your emotions, and they are so mean with even other people's emotions. So at workplace or in any social gathering or interaction, you realize that this is an individual, and at times you realize that it is even giving you problems to perform and work with these individuals. Then we have the antisocial ones. These are the individuals. Now they will go on social media, create pseudo accounts, and if they know very well about Lucy, and they know Lucy is my manager, and we have had differences in the office, they will create even pseudo account and start even insulting you, and they don't care. So they have little or if any concern for other people's feelings. Also, you realize that they're almost closer to narcissistic personality disorders, and they will often lie. This individual, they can even defraud you. So this is an individual who has a disorder that requires or needs help, then has repeated run-ins with the law, and the law, they will break the law. The management will say that no eating from the boardroom. Yeah, if you carry your food, eat from the kitchen, and they will take that lead, and they will never stop. Yeah, so they have repeated run-ins with the law and often violate the rights of others, of course. And then now we get to cluster C, which is classified based on the anxiety and fear. Now, these personality disorders makes an individual, to have the fear, or they are so anxious or to certain circumstances. We have avoidant personality disorders. Now, these individuals generally they have self-esteem issues. They are very sensitive to criticism, and a slight even critique, they take it as an embarrassment. They do not feel good enough. They don't feel important. And remember, it's a lifelong kind of pattern that has made this particular person to behave the way they are behaving. They are extremely shy, and they fear disapproval or appointment. So if you are a manager and you're dealing with such kind of, individual with such personality disorders, you know how to critique or their work or to criticize them, and again, you can even help them seek help. Then we have dependent personality disorder. Now, these individuals, in this cluster C, they rely so much on others. And even making a single decision of going to make a purchase of either his own shoes, they will want an approval. They want to carry someone along. And it's not like, it is not like, for them, it's normal. And if it's a lifelong kind of pattern, it turns out to be a disorder. They're very submissive. You tell this person, I want to go and send a mail to, Mombasa. Can you take me to Crown Center or Crown Coach office? They will take you. I want to go to railways. They will take you there. Okay. Of course, then this individual fear having take care of themselves. Of course, they feel confident around having people, and you realize that even they will land into even wrong relationships because they just want to depend on others. They are dependent person. They have dependent personality disorder. Then we have these ones that we call, we normally refer to them that I have OCD. It's, of course, it's a personality disorder, obsessive compulsive personality, whereby these people are perfectionists. You're sending a report. Instead of looking for the report, they're looking at where you did not place the full stop. And it's a continuous kind of process. And it makes this individual even to get frustrated to assign even tasks, because they feel like nobody can perfect the way I can perfect in this particular role. So you realize it's a struggle with this individual. They think everything needs to be perfect. Remember, we learn by mistakes. Yeah, when you're doing a task or a project, you realize that here and there will be some kind of hitches, and we learn from it. But now for these individuals with this OCD, they will be frustrated. It gets to a point where they are so much frustrated with the happenings. So this is classified under cluster C. So we have 3 classification: A, B, and C, based on the behaviors that are portrayed from this individual. Now, what causes this personality disorder? Someone will ask me, what causes this personality disorders? Genetics. This, this is a situation where these disorders are passed from a parent to the child, or one of the family members from their genes had this particular disorder and passes through the other person. And you find yourself, you are born just like that. You are just born an assist. You are just born an avoidant. You are just born a dependent person. So you realize that it passes from one gene to the other. Then brain changes. You realize that you may have maybe something like brain injury, and it may shift the part of the brain that responds to stimuli and fear. That the stimuli responds to fear and anxiety, and you realize that it has made you now to develop certain kind of personality disorders. Then the childhood trauma. You grew up in an environment where shouting was, let me say, it was just the order of the day. People don't know. We have such kind of families where individuals, the way of communication is shouting. Or you to survive in such kind of environment. Okay? So it now singles out what we are calling these personality disorders. I hope we are together. You can just put in the chat box if you're together. Then we have the verbal abuse. Also, are we together? Can you write something in the chat? Perfect, team. We are together. I'm happy that we are moving on very well. Now, we have these individuals who have gone through verbal abuse. And you've been frustrated to the extent, maybe you lived in a toxic environment where you've been getting verbal abuse, workplace toxicity, home, domestic violence toxicity. You develop the thick skin. So the thick skin makes you either you start now avoiding people, and it turns out to be a lifelong pattern, and you don't trust in anybody. You start developing trust issues, and you cannot confide in anybody, or rather you develop that their wings or do anything out of this their perspective. So it causes personality. Remember, I am insisting when we talk about disorders, it is a lifelong kind of pattern. Then now, how can we treat this? Okay, so how can we treat this? Of course, those who are having questions, we will respond to them just in a few after I'm done with this. So how are personality disorders treated? Someone said, how do we coach them? How do we? Of course, once you understand that you have these personality disorders, or people have been complaining about you. You know, there's a time that people who's around you can diagnose your personality disorders, because you as an individual may not know that you have these disorders. So they will be maybe complaining, and you pick out from that complaint about why is it that, you know, people are saying I'm a short-tempered person, I'm an angered person. So you can seek help, psychotherapy. You can work with mental health professional like psychology, psychiatric. They can provide support and education. And to some extent, those who are having erratic kind of behavior, you can use antidepressants to help you suppress on the you know, the stress. Then we have, the main goals of psychotherapy for treating personality. The main goals is to reduce immediate distress, such as anxiety and depression. And it will also help you to understand your problem. What is your problem? When you go through these sessions, you'll be able to help yourself and get the help, the assistance that you need. Then it will decrease unhealthy and socially undesirable behavior. Then modifying the personality traits are causing difficult. They will modify those traits, those characteristics. Those characteristics. Yes, Vicky, you raised your hand before we move to what are these consequences. It was a mistake, Vicky. You're on mute. You're on mute. If it was a mistake, let me know. But okay. So yes. So what are some of the risk factors, as we are trying to wind up based on the time slot that we have? What are some of the risk factors if you have these disorders? Basically, you're going to have poor relationships with the people. If you are acting in a way that is so demeaning and it's frustrating people who surround you, then it is also going to cause occupational difficulties. You are well experienced, you have the qualification, but you cannot stay in one company. And you feel that people are mean on you, but it's because maybe you have not identified these disorders that you possess. Then impaired social functioning, you realize you're not able to interact. People, like we said, human beings are social animals, and we cannot avoid socializing. This is a social gathering that we are all here, and we are learning. So you cannot avoid such kind of places. Then it can cause, of course, like they said, it can cause unemployment. Yeah, a divorce. How many people we have seen on social media having stories telling about them divorcing narcissistic kind of individuals, narcissists, or individuals who possess narcissistic personality disorders. Domestic abuse, of course, you get to the point where these individuals, they will frustrate you. Then we have substance use. You get to the point where now you can only get solace from taking substances, drugs. So for you to be able to to get that stability, because you have this disorder. Then homelessness, of course, you get to a point where you want to be alone, and now you can even run away from home. It's a disorder. Then crime, especially the antisocial, this one will find themselves in crime, because if you are defrauding people, you lie a lot, you go against what the rules and laws states, then you realize that you may get yourself in scenario where you have violated the law, and there's crime aspect. Now, how does understanding of these personality disorders help improve leadership skills? At first, remember, at workplace, we have different organizations that offers even annual medical checkups. And in most cases, we realize that we normally focus on the physical aspect of it. So if you are a leader, you are able to identify that, yes, Mary has this particular personality disorder that you have learned. And now, during that annual medical checkup, not necessarily that you'll approach this person and tell them that, you have personality disorders, but you can, as well as be able to just bring in a psychologist who can support this individual during annual medical checkups. If you have that benefit for your employees at workplace, then there will be effective communication. You know very well that this individual has issues with anger. They will always have an outburst. And when you're communicating with these individuals, you will always gauge your words. Those who take slight jokes as an insult, they won't be situation where you will tell them that kwani haujui jokes. It will be a kind of, effective communication where you know your limit, and it will also enhance empathy. Now, we normally look at these individuals with these personality disorders as, we look at them in a different angle. Yeah. For example, the way we have seen reviews on a narcissistic kind of personality disorder, people will term them like, a kind of, it's against, the norms. But you realize that it's a condition that requires help. This individual require help, and now it creates that empathy kind of part of you to to have the empathy on this individual. Then personal growth, of course. Once you understand who you are, of course, at the end of this session, you will understand your personality, starting from the point of view that we had to describe this. You'll be able to know, and you can now grow yourself based on how you understand who you are. Then dealing with the stress and the emotion reaction, you'll be able, as a manager, as a leader, you'll be able to handle this group in a better way, that you are serving each and every person depending on the personality that they have. Or rather, if they have any disorders, you know how to support them to manage. So that is how we can deal with these personality disorders. And now it gets to a point where we'll have to handle mentioned earlier, you realize that some organizations have these benefits of, medical checkup annuals at workplace. Can we incorporate the psychologist so that they support this individual? Or rather, we can recommend, if you are a manager, if you are a coach, then you can recommend on a fair ground, not just telling this person, we're going to issue. No, you don't go that direction. There's a way you can pass this information to the other, and then to the victim, and they can find help. Once they find help, then the coaching aspect comes in, because if you're dealing with somebody who is sick, they need to get treated so that you address other things. Then the next question, Purity, you said?
The other question is, how would one tell their boss that they have a personality disorder?
Thank you for that question. It's a good question and a tricky one, but based on my side of view and understanding, like we said earlier, understanding this personality disorder, it will not also give you a room for frustration. Once you realize that your boss has a condition and this is sickness, instead of being frustrated by his reactive characters, you just take it easy. Okay, you just take it easy on them, because now you cannot go and approach them and say, hey, Mr. Steven, I can see you are a narcissist. You see, it will not occur very well with them. So basically, it is now like we said, what is the importance of us, learning these disorders? We are able to deal with them. We can affect our communication. And at some point, you know that you're dealing with a sick person who needs help, and you don't get frustrated. Just like, I was telling someone, if you are, those who, the ancient time, if you are along the river bathing and a mad person carries your cloth and runs away, will you leave the water and start running naked with this person? No. This is a in fact, people will term you as a person who is now mentally ill. So it is a way of, once you understand their personality that they have, then you know how to communicate with them effectively without getting frustrated. Thank you for that. Yes. So you realize that you who is aware, you are able not, to, let me say, to interact with them in a way that will trigger their reactive characters. Remember, narcissists feed on the pain of those who are, their victims. You realize that. So once you realize that, this is a narcissist, when interacting with them, you are not going to, interacting with them in a way that actually it is going to make you suffer from their reaction, because you are aware. For them, they are not aware. So you carry yourself along in terms of, you are aware, and you don't want to cross their ways. You don't want there to be their food, because they will feed on your pain. Yeah, they are going to feed on, the nurses will feed on your pain. So you don't want to give them that chance. And you see, by doing that, you who is aware, you have avoided so many things, because so many people have fallen victims of this, narcissistic behavior, because they are also not aware that this person is a narcissist. So at the end of it, by the time they come to realize that they were dealing with a narcissist, it is already past even 10 years. So once you are aware of this, you can now be able to maneuver around, and because you can't go around telling people that you have this condition, you have this disorder, and at some point, even they don't want to be told.
Yes, thank you so much, Purity. Mary, very lovely presentation from you. I'm really grateful that, you touched on many different personalities and different disorders. But I've got a bit of a complex question, because I like that you started off with the personality types, because I realized that I'm a bit of a driver and a supporter at the same time. And to my understanding, you can be both personalities at the same time. But um, what scared me is that when you're explaining the different personality disorders, I realized that I might have ticked off 2 or 3 of those disorders. Um, Now, it's come to my attention, maybe I might have been, no, don't laugh, Barbara. I mean, I realized maybe I might have been rubbing people the wrong way, because I like people. I think I'm a patient person, but the reality is you look at that and realize not everyone is pretty much happy with having you on the team, having you in a project, having you at work. So, what ways can you, if you're in my shoes, what way can you work around that to make sure that people are more willing to be on your team? Because, for example, imagine you have a narcissistic personality disorder. You don't really notice that you like being the center of attention until you realize that some people don't like being around you. So, how can you work on that to make sure that people feel more welcomed, feel accepted in your team, and overall find it pleasurable to work with you? Thank you so much.
Okay, thank you so much, Jensen, for your question. Purity, you have something to input before I seal it up? So actually, the key aspect to pick here is awareness. Remember, if you're aware of, you have information, information is power. You have information and you're aware, then you are able to, help yourself. And even those individuals who are in your circle, basically you can have sessions where you can communicate and create that awareness. And you can even, go dig deeper to a specific disorder. And even, this is where then we get to point where we are writing books about a particular personality disorders, just to create awareness and having such kind of webinars to learn more and more.
Purity, what you said is very true. You can ask people, what do you think about me? Is it easy to work with me? Do you feel at home? But if they're already scared of you, do you think they'll tell you the truth? You scared them off. That's the thing, because I feel that if you, for example, you're a bit of a histrionic and a narcissistic personality, and then you're a D and an S, those are very scary combinations for some people. I'm thinking about what that can look like in the workplace. You have a project manager, who is that? You have a manager, who is that? And then they ask you, by the way, Purity, is it easy to work with me? Your job is on the line if you give the wrong answer.
Mhm. Sure. I'll still insist on awareness, self-awareness. And if you're aware of this, you have this information, then you can also pass the information to the group you belong to. And before we get to the, to having talks, or you can even get specialists like us from ACCUREX to talk to the team. We normally have, talks to our, kind of, team, the trainings. They can offer us that. And so if we can organize for trainings and like this, ACCUREX can offer you the best of all, so that to create that awareness in your organization. Thank you. You're welcome.
You too.
Someone is asking for the link for the. Okay. Okay.
Thank you.
Thank you. Bye.
Thank you. Bye.